Well, good morning, everybody. My name is Eric France. I'm the Physician Director of Population and Prevention Services at Kaiser Permanente. I thought I'd start by just showing you quickly this slide, which reminds us that when I introduce myself to people as an employee of Kaiser Permanente, one of the first things they usually say is, "Oh, I love your commercials. I love your ads." And many of you might have seen our advertisements. These in particular I pulled up because, of course, of their linkage to transportation. Step away from the vehicle, park farther, live longer, do tread on me, be your own cause, and thrive. This aligns nicely with our mission to improve the health of the communities that we serve. Now, this afternoon, I'll be in clinic as a pediatrician seeing kids. So in that work, I'm really focused on what every pediatrician is, which is taking care of a family, taking care of a child in front of us. So I thought I'd start this morning by having you come with me into that exam room as I see my first patient. So this patient, whose initials are SS, is a 12-year-old male. He lives with his mother. He's here today for a routine well checkup. He needs some shots for 7th grade, and so they're in today to see me. Mom and Dad are divorced. When I asked them how he's been doing, they mentioned that he's been short of breath when he runs in the gym, and that he's had a night cough and prolonged cough when he gets sick with a cold. He typically doesn't have time for breakfast in the morning. He orders food a la carte menu at school and drinks 1 to 2 sodas a day and a Gatorade as well. He might eat a vegetable with dinner when he eats at home, but probably 3 nights a week he's eating out from at a fast food restaurant. He gets, as I ask more about physical activity, he tells me how he has PE twice a week. My 13-year-old boy doesn't get any PE at his school right now. He rides the bus to school, and there aren't any late buses at his school, so he can't really stay afterwards to do any activities that might be available. The school itself is located at the edge of the development of his community, and it was a piece of land that was available when this community was built. It was quite large, and it's got a 6-lane road right next to it. So most parents drive, though he takes the bus. He doesn't really have any transportation options from school or from home to get to the local rec center or park. So instead, he typically stays home after school and is playing with his television or video games. His grades aren't great. He's a C student, and he's had trouble focusing while he's at school. When I do the physical on him, I find that he is obese. His weight is at the 96th percentile. His blood pressure for a 12-year-old is actually elevated, which goes along with being overweight and obese. I do a test because of this nighttime cough and determine that he's actually suffering from asthma, which is more prevalent with obesity in children. And I administer a questionnaire test to his mom, and it points to attention deficit as an issue for him at school. It also looks for other covariate illnesses, mental health illnesses, and it suggests that this boy has mild depression. So there's his life. There you see his story, and this is a common problem. And we might pause and ask ourselves, who owns this problem? Overweight children who have a lack of access to healthy foods, who have a lack of access to the outdoors. Is it the child's problem? Not particularly. Is it their parents? Well, to some degree, the parents can be doing more. The school, the community, the built environment, it's really all of us that own this issue. So my goals for this talk today is to demonstrate to you that this is really becoming a common problem. This is common in our practices in pediatrics. It's an expensive problem. There isn't much that I can do about it as a pediatrician, and I believe there's a whole lot you can do about it as transportation planners. When we think about the health of an individual, it's important to recognize that the healthcare system itself has very little impact on the total health of populations or individuals. Predominantly, those are driven by lifestyle behaviors. And in particular, you'll see here in this pie diagram that 51% of health status is influenced by 4 different lifestyle issues: tobacco use, physical activity, nutrition, and alcohol use. Here I'm pointing to alcohol use in a positive manner, so 1 to 2 drinks a night, and it's cardiovascular or heart health activities. What percent of Americans do you think don't smoke and exercise at least 30 minutes 4 days a week and eat 5 fruits and vegetables a day and have a glass of wine or beer with dinner every night? What percent of Americans hit all 4 of those healthy lifestyles? 2% was one goal. People are nodding. It's about 7%. It's about 7%. So if you're in the 7% club, congratulations. But you can see that it's not a common issue. The relationship between public health and the built environment, you've heard before. Here's a list of some of the more common issues that are addressed. We'll focus on the first 3: inactivity, obesity, air quality, and injuries, but recognize too stress, mental health, water quality, climate, and food supply are all clearly linked to this. This next slide shows you what you heard a little earlier about this increasing prevalence of obesity. This slide is in particular focusing on children and adolescents, and the pink line is for the 12 to 19-year-olds. This is meaningful to me because the line is initially flat, and that represents the years actually of the 60s and early 70s, my childhood. In 1980, when I graduated from high school, something started to change. And by the time I finished my medical training in 1994, the prevalence of obesity had doubled among children. And after 10 years of practice, it had tripled from 1980. So it had gone from a 5% prevalence to 15 to 20% prevalence in children, depending where you're located in the United States. Here for the state of Colorado, this shows you 2004 through 2007, the prevalence of overweight and obesity. At least it's not going up quite as much as it used to. But the two color schemes demonstrate that 13% of children in Colorado are considered obese, and another 13% are considered overweight. So 1 in 4 children is either overweight and obese. In general, in the United States, 2/3 of Americans are overweight and obese. 1/3 of them obese, 1/3 of them overweight. This is particularly important for some of our minority groups. So the Hispanic population of children in particular, almost 20%, 19.3% of them are obese, while only 10% of white children. This is certainly costing a lot of money. Many studies have shown us that overweight and obese citizens cost anywhere between 25 and 50% more in medical costs year over year. It's estimated almost $1 billion from direct medical costs and loss of productivity at work in the state of Colorado. This is a common slide you may have seen that when I was a child, 2/3 of us walked or biked to school, and now it's a little over 1 in 10 of us that will, of our children that do that. Many of our children are dropped off with drive-through systems, and a lot of that can be due to the built environment as well as culture. And so this quote is one I've liked quite a bit. We're spending many billions of dollars every year to build severe and long-lasting barriers to active living, by Dr. Jim Salas, who is a active living researcher in San Diego. And it's true. In this image here, we see a bicycle commuter facing a severe and long-lasting barrier to active living. Imagine this person, who happens to be me, biking to work, actually feeling pretty good about it. You know, I'm one less car on the road, I'm reducing congestion, and I'm improving air quality, which the federal government wants us to be working on. I have a 30 to 50% reduced chance of having a heart attack in the next 10 years if I'm a bike commuter routinely compared to people who don't. So I'm going to cost all of you less money through health insurance if I don't have a heart attack. I'll have less absenteeism at work. I'll be more productive when I'm at work, so my employee is getting economic advantage of someone who's biking. And I would say my family gets some benefit as well from having a dad who gets home after having a time to relax and unwind from a busy day. And we are building severe and long-lasting barriers to this kind of solution.